Hello, and thank you so much for joining me today. Our presentation is on what's new to Medicare for 2022. My name is Melissa Devine, and I am the site coordinator for Livingston, Washtenaw, and Monroe counties in the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B. Today, we're going to cover what's new to Medicare for 2022, why you should review your plan each year, what to look for when choosing a plan, and how MAP can help you understand your plan choices and potentially save you some money. Let's first take a look at what Medicare is. Medicare is insurance for three groups of people: those who are 65 or older, those under 65 with certain disabilities, and those of any age with ESRD or end-stage renal disease. Medicare has four parts to it: Part A, hospital coverage; Part B, medical coverage; Part D, prescription drug coverage; and Part C, Medicare Advantage. An enrollment typically takes place through Social Security for most beneficiaries enrolling in Medicare. And for railroad retirees, it takes place through the Railroad Retiree Board. If you're receiving Social Security benefits or railroad retiree benefits, enrollment may be automatic. However, if it's not, then you will have to enroll into Medicare during your 7-month initial enrollment period, unless you are going to delay enrollment into Medicare Parts A and B. When you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There's two main ways. First is Original Medicare. Original Medicare includes your Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. And then if you'd like a drug plan, you would enroll in a separate Medicare Part D drug plan. And if you'd like help paying your out-of-pocket costs in Original Medicare, like your 20% coinsurance, you can also shop for and buy a supplemental or Medigap policy. This can be used with any doctor or hospital that takes Medicare and anywhere in the U.S. The second option is a Medicare Advantage plan, also referred to as Part C. Medicare Advantage plans are an all-in-one alternative to Original Medicare because they bundle your Part A hospital coverage, Part B medical coverage, and usually Part D prescription drug coverage into one plan. These are HMOs or PPOs, and they function very similarly to a group health plan. These plans may have lower out-of-pocket costs than Original Medicare, and in some cases, you will even be able to purchase extra benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. But in most cases, you will have to use the doctors who are in that plan's network. Now we'll take a look at the Original Medicare updates. The 2022 Medicare Part A and B data is typically released in late November or early December. So currently the information we have available for you is for 2021. With Original Medicare in Part A, you do have a benefit period deductible of $1,484. That's for visiting the hospital days 1 through 60, and that has to be a hospital admission. If you need to stay in the hospital longer than 60 days, days 61 to 90 has a hospital copay of $371 per day. For days 91 to 150, it's a $742 per day copay. Now, once you were admitted to the hospital, if you needed to visit a skilled nursing facility, you'd be able to go to that skilled nursing facility for the first 20 days with a $0 copay. Days 21 through 100 is a $185.50 copay per day. The monthly premium for Medicare Part A is typically $0 if you've paid into Social Security for more than 39 credits. However, If you did not pay into Social Security and you have less than 39 working credits, you can pay anywhere from $259 per month to $471 per month in a premium for Part A. For Part B, the monthly premium in 2021 is $148.50 with an annual deductible of $203. With the auto reform changes that took place in the summer of 2020, many are wondering whether they should change their PIP coverage with their auto insurance provider. While we cannot speak to the coverage from your auto insurance provider, we can let you know that there are certain items covered by PIP auto insurance that Medicare does not cover. For example, under unlimited medical auto PIP coverage, you have coverage for long-term care, custodial health, that Medicare does not cover. Some services are also subject to the Medicare coinsurances or copays, leaving you with part of the financial responsibility. Unlimited medical auto PIP coverage will also cover medical non-emergent transportation, massage therapy, vehicle modifications, wage losses, and more, all of which Medicare will not. We highly recommend that before making changes to your auto PIP coverage, you take this information with you to your auto insurance provider and discuss the levels of coverage that are right for you. If you have a health savings account with a high deductible health plan, based on you or your spouse's current employment, you may be eligible for a special enrollment period to sign up for Part B without penalty. However, when it comes to Medicare Part A, in order to avoid a tax penalty, you and your employer should stop contributing to your HSA at least 6 months before you apply for Medicare. This is because your Medicare Part A coverage will start up to 6 months back from the date in which you signed up for Medicare or applied for benefits from Social Security or the Railroad Retirement Board. You are not eligible to make contributions to your HSA after you have Medicare. If your Medicare Part A coverage overlaps when you made contributions, you will have to pay a tax penalty. You can withdraw the money from your HSA after your Medicare coverage starts to help pay your shares of costs like deductibles, premiums, coinsurance, or copayments. Speak with your HR benefits coordinator or a tax professional for more information. Now, going forward, it is up to the employer to determine if their coverage is considered primary to Medicare or secondary to Medicare. If your employer plan is secondary to Medicare, you may have a gap in coverage due to coordination of benefits and end up with a late enrollment penalty. We highly recommend that you speak with your HR benefits coordinator or the HR department to learn whether this employer plan is considered creditable and primary to Medicare or secondary to Medicare. Now let's move on to Medigap Updates. Medigap plans are available to purchase if you enroll in Medicare and take original Medicare Parts A and B for your coverage. Medigap helps pay the coverage gaps with Medicare Parts A and Part B copays and coinsurances. There are select plans available to Medicare beneficiaries under 65 with disability. But some of these Medigap plan providers are now providing extra benefits, similar to those Medicare Advantage plans: dental, vision, hearing, and gym memberships. These programs are available to purchase with the policy or are a discount program provided with the Medigap plan. The companies that are offering these extra benefits include AARP United Healthcare, Blue Cross Blue Shield, HAP, Humana, Perkin Life Insurance Company, Priority Health, and Wisconsin Physicians Service Insurance Corporation. For more information on the specifics with these extra benefits, we recommend that you contact the plan provider for more. Medicare Prescription Drug Benefit Updates, Part D and Medicare Advantage. If you do not have creditable coverage and you do not enroll in Part D, then you will pay a late enrollment penalty. This penalty is added onto the monthly premium and will continue for the entire time that you have Part D coverage. It is calculated by taking 1% of the Part D base beneficiary premium for each month that you do not have creditable coverage and are not enrolled in Part D. This penalty amount does change each year as that Part D base beneficiary premium changes. For 2022, the base beneficiary premium is $33.37. That is the number that will be used to calculate a late enrollment penalty if you have one. Again, a late enrollment penalty will stay with you for life. Part D Income-Related Medicare Adjustment Amounts, or IRMA. Part D premiums are subject to income adjustments. Beneficiaries with a significant income will pay a sliding scale higher Part D premium based on IRS tax returns from 2 years prior. There are 6 income categories, and each category has a set dollar amount associated with it. For 2021, incomes that are over $88,000 for a single individual or $176,000 joint will pay the Part D IRMA in addition to their monthly Part D plan premium. If you've had a change in life circumstance, you certainly can appeal this decision with Social Security through the Life Circumstance Change form. For more information or help filling out that appeal form, give MAP a call. Some Medicare prescription drug plans may offer more than just standard coverage, including tiered copayments or coinsurances, lower deductibles. They may eliminate the gap in coverage, often referred to as the donut hole, and they may even change their coverage limits. However, for many, there is the standard Medicare Part D payment structure, which includes the deductible phase. If your plan has a deductible, you will pay full negotiated costs for your drugs until you've met the deductible. For 2022, the deductible is $480 with Part D. Once you've met that $480 deductible, you'll then enter the initial coverage period. This is where you and your plan will pay for your covered prescription drugs. You pay some of the cost and they pay some, and it'll go towards copayments or coinsurances. How long you stay in your initial coverage period depends on your drug costs and your plan's benefit structure. For most plans in 2022, the initial coverage period ends after you've accumulated $4,430 in total drug costs. Again, please note that the total drug costs include the amount that you and your plan have paid for your covered drugs. After your total drug costs have reached $4,430, you enter the coverage gap, also known as the donut hole. The donut hole closed for all drugs in 2020, meaning that when you enter the coverage gap, you're only responsible for 25% of the cost of your drugs, regardless of brand or generic. Although the donut hole has closed, you may still see a difference in cost between the initial coverage period and the coverage gap. For example, if your drug's total cost is $100 and you pay your plan's $20 copay during the initial coverage period, you will be responsible for paying $25 during the coverage gap because you're responsible for 25% of that $100 instead. In all Part D plans, though, you enter the catastrophic coverage after you've reached $7,050 in out-of-pocket costs for covered drugs, or Medicare has been billed $10,690 in full retail costs for your covered drugs. This amount is made up of what you pay for your covered drugs and some costs that others pay for your medications. During this period, you will pay a significantly lower copay or coinsurance for your covered drugs for the remainder of the year. Again, the out-of-pocket costs that help you reach catastrophic coverage include the amount you paid towards your deductible, what you paid during the initial coverage period, almost the full cost of brand name drugs, including any manufacturer's discount that you received while purchasing these drugs during the coverage gap, amounts that others may have paid on your behalf, including family members, charities, and amounts paid by state pharmaceutical assistance programs, AIDS drug assistance programs, and Indian Health Services. the coverage gap. This used to be referred to again as Medicare's donut hole. However, because it's been leveled out and everybody is responsible for 25% of the generic or brand medications, we often say that we have closed the donut hole, and that's why we're in the coverage gap. For those who have the low-income subsidy extra help benefit through Social Security, will not see a change in their benefit structure. That's because these beneficiaries will continue to pay their low-income subsidy extra help copayment amounts throughout the year until they reach the catastrophic level. And speaking of the low-income subsidy extra help benefit, for those who are not familiar with it, this is a subsidy program provided by Social Security. It helps with the cost of the Part D prescription drug coverage, including premiums, deductibles, and copays. The guidelines for qualifications into this program do change yearly. That would be in January each year. It is an income and asset-based guideline to follow. But for 2022, the Low-Income Subsidy Extra Help Program will cover monthly premium costs for plans that are participating at $31.49 and under. For more information or help finding a plan that may meet this number, give MAP a call. Now, there's no continuous open enrollment period for Medicare's Part D drug benefits. So for most beneficiaries, they are limited to certain timeframes to enroll in, disenroll from, or switch Part D plans. There's 3 enrollment period categories: the initial enrollment period, special enrollment periods, and open enrollment period. There are some circumstances in which people with Medicare are given a special enrollment period. Those can include an involuntary loss, reduction, or non-notification of creditable coverage, entering, residing in, or leaving a long-term care facility, moving, and some other exceptional circumstances. And for those who have a loss of creditable coverage, you're entitled to a special enrollment period as long as the loss of creditable coverage is not due to a non-payment of premiums. If you're switching from PACE, the Programs of All-Inclusive Care for the Elderly, or leaving employer coverage health plan, and more, you may qualify for a special enrollment period. For those who have access to subsidy programs like state's Medicaid or the Low-Income Subsidy Extra Help Program, you have a special enrollment period to make changes once per calendar quarter. And COBRA. If you take COBRA and it includes a creditable prescription drug plan, you may have a special enrollment period to join Medicare's drug plan without a penalty when COBRA ends. Now that is strictly for Medicare Part D, as COBRA is not considered creditable coverage for Medicare Part B. Open enrollment period is also known as the annual election period. If a beneficiary does not qualify for a special enrollment period and wants to disenroll from a Part D or Medicare Advantage plan, they can enroll in a new plan during this time. An enrollment change that occurs during October 15th through December 7th will automatically disenroll from the previous plan effective January 1st the following year. So for this open enrollment period in the fall of 2021, the coverage that you elect to sign up for will become effective January 1st, 2022. Medicare's Plan Finder. It is a one-stop shop for all things Medicare. It's located online at medicare.gov, and it allows you to create a personalized account. With your personalized account, you have access to all things Medicare, like your Medicare summary notice, pay for your Part B premiums, personalized plan information tailored to your needs, and more. This is what we at MAP use to find you the right plan. While we at MAP highly encourage you to create a login with Medicare's Plan Finder, we do understand that it may not be the preference for everyone. If you're wanting, we can still do an anonymous search when it comes to your review of coverage. Speak with a MAP counselor for a personalized search today. Give us a call, 1-800-803-7174, to schedule an appointment with someone today. Medicare uses a star rating system to measure how well Medicare Advantage and Part D plans are performing. They score how well plans perform in several categories, including quality of care and customer service. These ratings range from 1 to 5 stars, with 5 being the highest and 1 being the lowest. Plans are rated in each individual category and then assigned 1 overall star rating to summarize the plan's performance as a whole. The beneficiary can use the overall star rating to compare performance among several different plans. Medicare reviews plan performance yearly and releases these new star ratings each fall. This means that plan ratings may change from year to year. Before considering a plan star rating, make sure the plan's coverage suits your needs. And in an effort to promote better plan quality and better choices, Medicare will be sending notices to those who are in a Part D drug plan or a Medicare Advantage health plan that fails to get at least a 3-star quality rating for 3 straight years. This notice will let you know about a special enrollment period to enroll in a 4 or a 5-star plan. This is your fall timeline. We know that majority of these things have already happened, but we still just want to bring some things to your attention. You should have by now already received your copy of the Medicare New Book. If you have not, give MAP a call. We can get you an electronic version or a hard copy version. You also should have received your annual notice of change by now from your current plan coverage. If you have not, you'll want to make sure that you look for that envelope. And of course, we're right in the thick of open enrollment period. It is effective here October 15th through December 7th, and any changes that you make to your coverage will begin January 1st, 2022. Now again, we did mention that you should have received your Medicare plan's annual notice of change in September. If you haven't received it, look for an envelope from your insurance provider. And note that it may be a little different than most because these annual notice of changes come on thinner paper. But this annual notice of change is really important. You're going to want to check to see what the changes are with your premium, deductible, and copays. They may also have made changes to the coverage for your medications. And if they did, and your medication is still covered, are they at the same tier coverage? Are there any restrictions to your medications? Could there be a better plan option out there for you? Medicare also makes mention of 3 important things within their Medicare New Book that's new. For 2022, that includes COVID-19 related items and services, cognitive assessment and care plan services, and blood-based biomarkers. Medicare is now going to cover several items and services related to COVID-19, like vaccines, including the booster, diagnostic tests, antibody tests, monoclonal antibody treatments. And please note that these coverages could change when the public health emergency ends. In terms of cognitive assessment and care plan services, Medicare now covers a separate visit with the beneficiary's regular doctor or a specialist to do a full review of cognitive function, establish or confirm a diagnosis like dementia, including Alzheimer's disease, and developing a care plan. You can bring someone with you, like a spouse, a friend, or a caregiver, to help provide information and answer questions. During this visit, the doctor is going to perform an exam, talk with you about your medical history, and review your medications. They'll create a care plan to help address and manage your symptoms, help develop or update your advanced care plan, refer you to a specialist if needed, and help you understand about community resources like rehabilitation services, adult day health programs, support groups, and more. For the blood-based biomarker test, Medicare is going to cover that lab test in certain cases, if available, once every 3 years. To be eligible, you must meet the following conditions. You must be between the ages of 50 and 85, show no symptoms of colorectal disease, and be at average risk for developing colorectal cancer. You're going to pay nothing for the test if your doctor or other qualified healthcare provider accepts assignment to Medicare. Some things to consider when it comes to your Part D plan enrollment. Certainly always want to look at the cost. What's the premium? How high is the deductible? What are the copays for your meds? Could your insulin be a part of the senior savings model? You're also going to want to look at the following in terms of coverage. Are your medications covered? If so, at what tier are they covered at? Will you require a prior authorization, quantity limits, step therapy? Is this coverage nationwide? Can I use it when I decide to go south to Florida in the winter? And what pharmacies are considered to be in-network and preferred in-network? Or, if you prefer mail order, is mail order an option? With your 2022 Medicare Part D options, there are 23 Part D plans available in total. There are 4 plans with a $0 deductible, 5 plans under a $25 monthly premium, and 2 plans that offer gap coverage. With 23 different plans to choose from, it can really add to the maze of Medicare. Don't navigate this alone. Let MAP counselors help you. Now, a few slides earlier, we did discuss the Medicare Plan Finder star rating system. And again, in an effort to promote informed and better choices of high-performing plans, Medicare disables the online enrollment feature in the Medicare Plan Finder tool for plans that are low-performing, so 3 or fewer stars for 3 consecutive years. These plans have a low-performing icon along with a message warning you that the plan is poorly rated. If you are still interested in enrolling in that plan, you will need to contact the plan and enroll with them directly. Now for 2022, we don't have any plans quite that far off, but we do have 2 plans with a 2-star rating that you technically can still enroll in online. But we just want to bring these to your attention when you are going over your benefits. That would be ClearSpring Health Value RX and ClearSpring Health Premier RX. Now, when it comes to your Medicare Advantage plans, there are a few extra things to consider besides just the drug coverage. You're going to want to know whether you have a primary care physician that's in or out of network for them. Maybe you see specialists regularly. Are they in or out of network? If they are out of network, does this plan have out-of-network benefits, or will you need to find a new physician? Does this plan offer extra benefits like dental, vision, hearing? Maybe fitness benefits are important for you, transportation, telehealth, and more. This year for the Medicare Advantage plans, we have a lot of plan options. The lowest monthly premium is a $0 monthly premium. There were too many plans to list there on the slide. And the highest premium is $300. That's with Medicare Plus Blue PPO Assure. But with 58 plan options in Livingston, 47 in Monroe, 45 in St. Clair, 57 in Washtenaw, there's just so many plans to look at. That's why you should give MAP a call for more assistance. We really can help you understand the benefits with each of these plans. Now, something we are really excited to share with you is that there are 9 Medicare Advantage plans this year with a 5-star rating. That means that these AARP Medicare Advantage plans and Blue Care Network Advantage plans have been rated through those individual categories and given an overall star rating of 5. Very exciting stuff. If you have a Medicare Advantage plan that's effective January 1st, 2022, you qualify for another enrollment period, January 1st through March 31st. During this time, if you decide that you're unhappy with your current Medicare Advantage plan coverage, you can change to a different Medicare Advantage plan or even back to original Medicare with a Part D plan. However, in order to utilize this Medicare Advantage open enrollment period, you must have a Medicare Advantage plan effective January 1st. So how do you enroll in a Part D plan or Medicare Advantage plan? Well, you can certainly enroll online at medicare.gov, enroll online with that plan's website, contact the plan company of your choice and request an application packet, call 1-800-MEDICARE for assistance in enrolling over the phone, or call MAP. Give us a call at 1-800-803-7174. Now, there are certain guidelines that these Medicare plans have to abide by when it comes to marketing. They certainly cannot market themselves as Medicare endorsed. They can't solicit door-to-door. Call people on national and state do not call lists, offer incentives that exceed $15 in value, market outside of their planned service area, make cold calls, and more. If any of these things on this slide happen to you, reach out to us at MAP so that we can report it and get these things under control. Speaking of scams, Medicare fraud and abuse is always present, whether it's through the phone, through the mail, billing, and more. So we want you to check your MSNs regularly, that's your Medicare summary notices, for any discrepancies that may have been billed for healthcare services. Pay attention to who's calling you. Medicare won't call you out of the blue and ask for your Medicare ID number. And when it comes to COVID-19, you don't have to give your information out to anybody. There is no need to give your Medicare ID number, banking information, or credit information to contact tracers or more. If any of these things happen, it is likely a scam. Report it to your local senior Medicare patrol, which happens to be MAP. You can give us a call at 800-803-7174. So how can a MAP counselor help you? Well, a MAP counselor can help you understand your Medicare health plan options. We can help you compare and enroll in Medicare Advantage coverage, compare and enroll in Medicare prescription drug coverage. We can help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like the Low-Income Subsidy Extra Help Program and Medicaid. For resources outside of MAP, you have options like the Medicare New Book, which is state-specific and can show you specific plans for Michigan. There's Medicare.gov, Medicare's website and plan finder. And of course, you can always call 1-800-MEDICARE as well. But for the best resource for your local Medicare information, it's MAP. Our services are free, we're unbiased, and our certified counselors are not sales agents and are not affiliated with private insurance companies. We can be your best resource for all your questions and concerns Medicare. No question is too small or difficult. We've saved even over $2 million for beneficiaries in your area. So for your personalized MAP appointment, give us a call, 1-800-803-7174. Open enrollment is already here. It's October 15th through December 7th. Let MAP help you. Thank you so much. You guys have a wonderful day.